Here's the opening to that diverticulum. Now we'll return to the dissection to follow the course of the colon. Here's the ascending colon. It's held in place by the peritoneum of the posterior abdominal wall, which covers it on the front and sides. The ascending colon ends a long way back. At this sharp 90-degree turn, the right colic flexure or hepatic flexure. The hepatic flexure lies just below the lowest part of the liver and the gallbladder, and in front of the lower part of the right kidney, which is back here. The transverse colon crosses the abdominal cavity from right to left. Here, the transverse colon has been pulled upward along with the greater omentum. Here's where it's normally located. In its natural location, it's partly hidden by the greater omentum that clings to its anterior surface. The omentum isn't the real attachment of the transverse colon, it's only loosely adherent to it. The real attachment of the transverse colon, which we can see when we pull it upwards, is this double sheet of peritoneum, the transverse mesocolon. We'll take the transverse colon out of the picture to see its attachment. Here's the divided transverse mesocolon. It goes from here to here. It crosses the head of the pancreas, which is here, and also the duodenum, which is here. This is the divided route of the mesentery. The transverse colon hangs down in a curve that's parallel to the greater curve of the stomach. The two structures are connected, as we've seen, by the part of the greater omentum that's known as the gastrocolic ligament. The transverse colon ends higher and even further back than it started. At this sharp downward turn, the left colic flexure or splenic flexure. With the colon in its natural location, the splenic flexure is out of sight, right up here. The splenic flexure lies just below the spleen and in front of the left kidney, which is back here. Below the splenic flexure is the descending colon. Just like the ascending colon, it's fixed to the posterior abdominal wall. The descending colon is quite short. A little below the iliac crest, which is here, the descending colon is continuous with the sigmoid colon. The sigmoid colon forms a large, freely mobile loop that's attached by this double sheet of peritoneum, the sigmoid mesocolon. The sigmoid colon passes down into the pelvic cavity. There's a lot of it down there, which we'll bring out. As it passes into the pelvic cavity, the sigmoid colon approaches the midline. The sigmoid mesocolon becomes shorter as it enters the pelvis and ends altogether down here. The sigmoid colon ends at the level of S3, where it merges with the rectum. Now we'll look at the rectum, where fecal material is stored before being eliminated. Looking down into the pelvis from above, we can only see the most proximal part of the rectum. Here it is. To see all of the rectum, we'll look at two different specimens, one divided along this line, one along this line, going all the way down through the pelvis and perineum. Before we look at the rectum, we need to get our bearings. On each side, the cut went through the iliac crest, the blade of the ileum, the acetabulum, and the ischiopubic ramus. Here's the same cut made on a dry bone specimen. Here's the pelvic brim, and here's the pelvic brim in the dissection. Here's the cut edge of the peritoneum that lines the small upper part of the pelvic cavity. Here's the lower end of the sigmoid colon. Here's the rectum. From here, the peritoneum that covers the upper part of the rectum sweeps forwards, leaving most of the rectum with no peritoneal covering. We'll come back to this view in a minute. To see what's behind the rectum and in front of it, we'll look at a different specimen that's been divided just to the left of the midline, leaving the rectum intact. Here's the promontory of the sacrum. Here's the divided body of the pubis. Here's the rectum. Here's the lower limit of its peritoneal covering. The rectum lies in front of the lower half of the sacrum and the coccyx. It conforms to their overall curve. Here in its lower part, the rectum runs downward and forward on this sling of muscle, the levator ani. The levator ani is the principal structure of an important partition, the pelvic diaphragm. The rectum turns sharply backwards as it passes through the pelvic diaphragm, becoming continuous with the anal canal. In front of the rectum are the bladder, the seminal vesicles, and the prostate in the male, and the uterus and vagina in the female. To see some more details, we'll go to the front view again. As the sigmoid colon merges into the rectum, the tenei broaden out so that the rectum has a coat of longitudinal muscle that's almost continuous. The lower part of the rectum, known as the ampulla, is quite distensible. This space around the rectum isn't empty. In life, it's occupied by fatty connective tissue that accommodates to changes in the size and shape of the rectum. Here's the pelvic diaphragm sloping down on each side. It's formed mainly by the levator ani muscle. This is the puborectalis part of the levator. As the rectum passes through the pelvic diaphragm, it becomes continuous with the anal canal, which ends here at the anus. The lower end of the rectum runs downwards and forwards. The anal canal runs downwards and backwards. The angulation between the rectum and anal canal, the perineal flexure, is maintained by the forward pull of the puborectalis part of the levator ani muscle. Closure of the anal canal is maintained by the internal and external anal sphincter muscles. The involuntary internal sphincter is a continuation of the circular smooth muscle coat of the intestine. It's present in the proximal 2/3 of the anal canal. The voluntary external sphincter runs the full length of the canal. This is the external anal sphincter. It's somewhat funnel-shaped. Above, the external sphincter merges with the levator ani muscle. Its upper part consists largely of annular fibers that go all the way round. Its lower part is formed mainly of fibers that pass from back to front. Behind these, fibers are attached to the anococcygeal ligament. In front, they're attached to the perineal body, or central perineal tendon, which is here. The levator ani muscle is shown in more detail in tape 3 of this atlas. Now that we've looked at the whole length of the gastrointestinal tract, let's review what we've seen. Here's the stomach with its greater curve and lesser curve. Here's the esophagogastric junction, the fundus, the pylorus, and the pyloric antrum. Here's the dependent greater omentum, the gastrocolic ligament, the gastrosplenic ligament, the lesser omentum, and the epiploic foramen. Here's the duodenum, the jejunum, the cecum, the vermiform appendix, the ascending colon, transverse colon, descending colon, and sigmoid colon. Here's one of the tenei coli and the haustra of the colon. Here's the mesentery and its divided root. Here's the transverse mesocolon and its divided root. And here are the rectum and the anus.